The U.S. is launching what is now the largest vaccination effort ever in the nation's history. Trucks and cargo planes carrying the first 2.9 million doses of Pfizer's newly authorized coronavirus vaccine are being dispersed across the country. Initial shipments will arrive at 145 distribution centers. The first shots are set to be given to healthcare workers and nursing home residents. The vast majority of Americans will not be eligible for vaccination until well into 2021, as we mentioned. Now, this comes as the virus continues to devastate communities across the country at record levels. The country is just shy of 300,000 coronavirus deaths. And David Begnaud is in Sacramento, California, with more on how hospitals are preparing for the vaccine's initial distribution.
How do you feel about getting the shot? How are you feeling right now?
I want to clap my hands. I'm so excited. I've been waiting for this.
Eva Teniola, who's been a nurse for 15 years, is anxiously standing by for that call, which so many healthcare workers have been waiting for. She is going to be the first person to get the coronavirus vaccine at UC Davis.
As a caregiver, I've witnessed the worst scenario. That's why I've been waiting for this vaccine, because I believe this would end this pandemic. Thank you, son.
She says she's doing it for the safety of her own family, including her son, Raphael. She's been told that when the call comes, they want her at the hospital in 30 minutes.
What we have here is an amazing setup. It is basically an assembly line.
Dr. David Lebarski is CEO of UC Davis Health.
Why such a race?
Well, every single day matters.
He says they plan to vaccinate about 1,000 frontline workers every day, starting with those who work in the emergency department.
This is probably the most exciting day of 2020, maybe the most exciting day in the last 20 years. The number of people who are dying every single day is huge, and the vaccine is our way back.
Pfizer partnered with UC Davis back in August to carry out part of their vaccine trial, testing the vaccine. These 4 people were all involved. None are aware of whether they got the real thing or the placebo, but Jessica Hallstrom and Nicolette Santiago say they had symptoms that lasted about a day or two.
I had really intense chills, a little bit of nausea, headache, a lot of just shivering.
For Professor Rafael Sanchez and Dr. David Cook, the side effects were minimal.
What would you all say to Americans who will watch this and say, you know, I don't want to be the first?
So I get a lot of statements from my patients over the years saying, I don't want to be a guinea pig, especially my patients of color from communities that have historically have cause and reason not to trust healthcare. Yet I volunteered for this trial so you can take this vaccine and help turn the tide in your communities.
I remember Dr. Cook saying, we were the guinea pigs so that you don't have to be. This is the room where the vaccinations will start as soon as the shipments arrive. All the chairs socially distanced. As we said in the piece, they're aiming to do 1,000 vaccinations a day. They've had about 750 employees infected with the coronavirus since the pandemic started, and it's part of the reason they are moving so fast. I mean, here at UC Davis, they've literally said, when we get the shipments, we want to take some out right away and start injecting people within a 2-hour period. You heard from Eva. She's one of the several people they literally have on call at a moment's notice to respond and get down here to the hospital. In terms of how they're tracking their shipment of those vaccines, they do it just like you track Christmas gifts. They've got a FedEx number, they put it in the system, and they watch that plane fly. Vlad and Anne-Marie, back to you.
All right, David, thank you. So for more on this, let's bring in Dr. Ron Elfenbein. He's the medical director and owner of First Call Medical Center. Doctor, thanks for joining us this morning. Again, across the country, governor and state health officials are preparing for the distribution of the vaccine. How are hospitals and other healthcare centers preparing to administer this vaccine? It's pretty complicated. And what does the process look like?
Well, good morning to both of you and to all the viewers out there. It is quite a complicated undertaking, as you might imagine, and as your piece just sort of went over. It's not as simple as handing out a package of Tylenol for a number of reasons. Probably the biggest one is that, you remember, this is a 2-dose vaccine. So everybody that gets 1 dose has to be scheduled 28 days later to get that 2nd dose, and it has to be 28 days later. So you have to schedule people that are able to come back to get that 2nd dose. 21 days later, excuse me, for the Pfizer vaccine. So, they have to be able to come back to get that 2nd dose. Every hospital is handling this a little bit differently, just like every state is handling this a little bit differently. So the federal government essentially is giving it to the states, and then the states are able to sort of distribute it based on their individual plans that they've come up with. And then the hospitals are doing the same thing. And obviously, the hospitals are doing it under the guidance of the state's health department and the CDC and the FDA, but they still have some leeway in terms of how they're doing it. So, for example, one of the hospitals at which I work at multiple hospitals, but at one of them, we got an email saying, "Are you interested in getting the vaccine? We encourage all of our frontline physicians to get them. Are you interested?" And they've sort of assigned a tier status to the healthcare workers. So I'm an emergency room doctor, so I'm tier 1. Tier 2 would be people who see patients but aren't quite as exposed as, say, I would be. And then tier 3 and tier 4. Tier 4 would be somebody like a radiologist, talking about it as a physician, who really doesn't interact with patients as much, but is still in the hospital and is still a healthcare worker. So most nurses that are interacting with patients, aside from admin nurses, would be a tier 1 type of person. Most medical techs would be a tier 1 type of person. So, there's a lot of people you're talking about to have to vaccinate, and there's a limited number of vaccines. So the hospitals are reaching out to people and saying, "Are you interested in getting it? We'd encourage you to do it. And if so, please get back to us and we'll schedule you a time to come and get it."
Doctor, as you know, many hospitals are still being overwhelmed with the number of rising cases of the coronavirus. How will those hospitals accommodate both the current surge and this major vaccination effort? What are your biggest logistical challenges in this process?
Yeah, so you hit the nail on the head there, because it's all about logistics. It's really a logistical nightmare, if you want to phrase it that way. You're right, because the hospitals are overwhelmed. Their ICU beds are running out. They're trying to figure out just where to put patients. The admin people are struggling to find places to store patients. I hate to phrase it like that, but that's what's happening. There's no more beds in the hospital. There's no more beds in the emergency room. There's no more beds in the ICUs. So they're trying to figure out, what can I do with all these people? And then on top of that, they're trying to schedule, this amazing and incredible vaccine effort that requires thousands and thousands of man hours to figure out all the logistics behind this. So it is a logistical nightmare. I think a lot of the hospitals have really, at least the ones I'm involved with or affiliated with, have really done a great job of stepping up and managing that, sort of compartmentalizing that. The people that are dealing with the clinical aspect are dealing with the clinical aspect only, and they have other people, administrative people, who are only dealing with the vaccination program. And they've done a good job of separating that. I can't speak for every hospital, but the few that I've been associated with and that I've been getting emails from to try to get me vaccinated have done a very good job of that, and they seem very, very well organized.
The chief advisor to Operation Warp Speed, Dr. Monsef Salawi, said yesterday that around 75 to 80% of Americans will need to be immunized in order to reach herd immunity. It's pretty high. A recent poll show only about 60% of Americans are actually willing to get the vaccine, feel comfortable with it. So what do you want people to know? Because there are still a lot of concerns about how quickly it seems that the vaccines were developed, not just this one, but the other ones that are sort of in the pipeline, and how quickly they've been, they're being put out to the general public.
Well, first of all, I'm actually kind of excited by that study that you just cited, Emery, that says 60%, because we've spoken before and it was as low as 40%. So that number's going up, which is a good thing. I would say that regarding herd immunity, remember that there are people who lots and lots and lots of people who have had coronavirus and therefore should help along with that herd immunity. So I'm not sure that 70% of Americans really need to get vaccinated to reach that number. I mean, that's kind of a difficult number to know what exactly that number would be. But let's assume it's 70%. It's probably a little bit lower, but assuming it's 70%, I think, the fact that we've been able to produce not one, but two vaccines that are ready to go. One of them has been FDA authorized. The second one should be this week. There's at least 3 more vaccines that I'm aware of that are almost ready to go and that will be ready to go probably in the next month or two. I mean, is absolutely miraculous. I mean, I can't put that in any other term. Normally, it takes about 10 years to get a vaccine from its inception to its market, and this has been done inside of 8 months. It is something that is just, to put it in perspective, I mean, I've said this before, but it's really, scientifically speaking, like putting someone on the moon and bringing them back safely. It is unbelievable, absolutely miraculous that we were able to accomplish this. And people, I understand people are nervous and people are scared. It has not been FDA approved It has been FDA authorized. The Pfizer vaccine has only gotten an FDA authorization. Now that means that there's, enough data that the FDA feels that it's safe and it's secure and it's okay for people to take. Now I've reviewed quite a bit of this, and I feel confident myself. I will be taking this vaccine. My wife will be taking this vaccine, who is also a physician, and I've recommended it to everybody that has asked me. So, I'm a pretty conservative person, and I wouldn't take something I didn't feel comfortable with. People have to make the choice themselves, but the data speaks for itself. I mean, I would encourage people to, if they're nervous about it, it's all online. You can download it. You can look at it yourself. So rather than, we've discussed this before, Anne-Marie, but I think rather than listening to your cousin's friend on Facebook, who floats some ridiculous conspiracy theory, read the data yourself. Take a look at it. If you don't understand it, ask a friend. Yeah. Call a doctor friend of yours. Call a scientist friend of yours and say, hey, I don't understand this. Google it. Read about it. Do your own research. Make your own decision, because the data speaks for itself.
It really does. And Dr. Ron Elfenbein, we appreciate you coming on to sharing the science and the data behind this, what is a really momentous occasion in this battle against the pandemic. We appreciate it.
Thank you both. Stay safe, guys.
You too.